Today, let's take a trip to Ireland.
She was nonverbal at all. She didn't respond on her name on anyone who will talk with her. She didn't see, we'll say it like people around her. Very, very picky eater. Extremely picky eater. She has like a diarrhea, every day. Now she sleeps all night. She talks now. So amazing to see that your child is improved, and that he or she, whenever will have a good future.
Hello, everyone. Welcome back to the BioNexus Health Podcast, Autism Uprooted. Today, let's take a trip to Ireland and speak with Christina, an amazing mom of a little girl who's made a phenomenal recovery. And it would be great to hear it straight from Christina, the hard work and the rewards that come after. So let's go ahead and welcome Christina from Ireland to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hello.
Hi, Christina. How are you?
Oh, thanks.
Good. Actually, you're in Ireland, and looks like you have sunshine today.
Yes. We have something around 17 degrees sunshine with bit wind, but it's okay. Yeah, weather is very nice in Ireland here. Yeah.
Wonderful. Yes. We had lots of rains the last couple of days here in New Jersey, but hopefully today seems to be a much better day. So good.
Yeah, we get as well. Yeah, a few days ago the rain started. Yeah, so but anyway, there is a sunny, nice weather. Yeah, it's very nice spring.
Yes.
It's almost summer.
Oh yes, I know exactly. Finally, right? After a long, hard winter. Yeah. So, we are speaking about Carolina today. Yes. And so let me begin with just, starting with asking you, how did you find BioNexus Health, and what made you decide you want to do the herbal protocol?
So yeah, I started researching in Google, in YouTube, everywhere because I want to help my child. So yeah, and I found you. I was looking for some reviews. So yeah, that's why I make decision. We should try. Yeah, and thanks God we tried. Yeah, because it works wonderful. Yeah.
Oh, wonderful. See, that's what I was going to ask you next, is that, could you discuss what symptoms did Carolina have before?
Yeah, so she was nonverbal at all. She didn't respond on her name on anyone who will talk with her. She didn't see, I'll say it like people around her. If some child will came to her, to say hello, it looks like there's no one, around her. So yeah, strange behavior, yeah, like very, very picky eater, extremely picky eater, yeah. So some, movements, some, steams and
Stimming?
vocalizations, yeah,
Okay.
some,
What kind of stimming did she have?
like if to remember before 1 years old, like around 10, 11 months, when she was sitting, she was like rocking, Yeah, I noticed it. Yeah, later on, she like, watching some kind of cartoon, one type of cartoon nonstop, and she was jumping on the, sofa. It's like nonstop was like that,
Okay.
and then she, yeah, put, the toys in them, like in one line. So,
Okay.
the things was happening every day. She was doing same things. So, yeah.
Right. She was lining up her toys. She was doing repetitive things, more and more
Yes,
symptoms.
yes.
How was her digestion?
Uh, she was going to toilet few times a day.
Okay.
Really, yeah, I was thinking, oh, that girl has a, very fast digestion, but actually that was the problem. One of the, yeah. So yeah, almost I will say she has like a diarrhea, yeah, every day. So
Okay.
yeah,
Okay.
digest wasn't good. So before, yeah,
Yeah,
now it's
digestion.
perfect.
Yes, I know. I wanted to talk about that, but could you tell me, was there any problem with her before? Was there any problem with the sleep? Was there any problem with her understanding what you were saying?
Yeah, yeah, the sleeping wasn't good. Like she was waking up several times a night. Sometimes she was came to me, yeah, and she was, make some noises.
Mm,
Um,
okay.
yeah, that was before, yeah. And when we start, the first step we start with the diet. We was
We did,
keeping,
yes, yes.
yeah,
So,
yeah,
after all of these symptoms, you found me, and then you wanted to do all natural. Now, you're if I'm not mistaken, originally from Latvia.
yeah, original from Latvia.
Yes, I mean I've been to Lithuania, and I met many Latvian doctors there as well, who had come for physician training with me, and uh, the information I got was that Lithuania, Latvia are very natural oriented people, like
Yes, yes, it is,
mostly
yeah,
natural healthcare. Yeah,
yeah,
wonderful.
yeah.
Okay, okay.
So
So,
yeah, after the diet, she calmed down. She wasn't so hyperactive and she sleep improved a lot. She was sleeping almost all night, yeah. Now she sleeps all night. Sometimes she may wake up, ask for light. Yeah, she don't like sleep in dark, so but everything is fine. It's completely
everything is.
different. Yeah, it's completely different child. Yeah.
Let's talk about all the improvements you saw, and she's been on the BioNexus protocol about a year,
Yeah, a bit more than here. Yeah, like that. So
right?
yeah, she sleep improve. She's behavior improve. She talk now.
That's the
She
main thing. So that's
yeah.
fantastic, right? She is like, she's verbal. So when you say verbal, she can talk now. What does that mean? She's speaking one word or she's speaking sentences.
Oh, she tried to make sentences and she commenting. She commenting if she see something, if she play, if she draw. She always bring me and show, mommy, it's a doll, it's sister, it's cat, and yeah, she commenting. The speech improve. She understand. If I ask, can you close door? She straight away go and close door. Like before, if I will ask, can you close door? She just, look at me and didn't realize what I want, because yeah, she didn't understand what I asking for. Yeah, yeah, it's wonderful. It's wonderful when your child starts speaking. Yeah, in school
Yes,
as well,
yes.
like in preschool, they said she playing with the kids and then she know all kids' name, and she's completely different child.
So she is being social. She's playing with the other children. She's talking to the other children.
Yeah, yeah.
Okay. I just love to hear this, that she's making her own spontaneous comments, right? Her language is it spontaneous?
Yeah, yeah, it is.
Okay. How about her sleep, her gut?
The sleep is good. She sleep all night. The gut is also good. Digestion is okay. She going to toilet maximum is twice a day. So
Okay.
everything is normal how it should be. So there's no problem. Yeah.
Okay. Like you said, it's a different child.
It's completely different. She looks different. She walk differently. I don't know how to explain. She's body looked differently because before she was very, very tiny and looks like, there's not enough muscles. And now I can see the relief of muscles. She's different. Yeah,
Mm.
she walking different, she acting different, she look at us and she smiles and play. It's completely different child. Yeah. It looks like she's a healthy child.
Yes. Can you actually, I'm having some problem with Zoom, looks like. So, give it 1 second.
Yeah.
Yeah, I think we are back now. I guess, a little bit of problem with Zoom, but yes, I whatever you said was recorded. That's not a problem. Good, good. Okay, so you must be happy as mom that looks like you have almost fully recovered her.
Yeah, I will say we are, almost on the finish. It's a completely different child. It's so amazing to see that your child is improved, and that he or she, whenever will have a good future,
Yes.
healthy, good future. It's
Yeah.
most important.
How is she doing academically at school? She's able to study, focus.
Yeah, yeah, she can count to 100. She know alphabet, she know letters, and she sings some songs. And when she came from after school, she started playing with the dolls like she's in the school, and she named each doll, the classmate names, and yeah, she everything repeat what's happening in the school, and it's very very nice to see that. Yeah.
So she comes and tells you what's happening at school.
Like no, it's not yet. She didn't came and tell me, but I can see when she play what's happening in the school, and she remember all games, what they did, and all songs she tried to sing, maybe not properly, because we use three languages at home. So, but I can say her English improve, and then even Daddy's language improve as well. So yeah.
Okay, well, I want to know a little bit more about this, Christina. So now you're saying she understands three languages. Which languages are those?
So the main is a Latvian language, and I will say the second place is English, and the third place is a Russian language.
Oh, wonderful. Okay, so she understands Latvian, English, and Russian.
Yeah,
Which language is she able to talk in?
Latvian and English, and some Russian as well. So
Wow.
they all improve. Yeah, she will be a very smart girl.
Yes, I mean, look, that was something you always told me that, I know she is smart, but she's not talking, she's nonverbal, and, I know it is there. She's a smart girl. And now, because I'm a big believer in mother's instinct. So when you told me that, of course, a mother knows their child. So this is fantastic. So now you have your, whatever you said was true, and you have a little girl who is trilingual almost. I love that. I just love that.
Yeah, fantastic,
Yes.
fantastic. See everything. Yeah, it's just, and I know it will be better and even better and better. Yeah, yeah, it's very nice. Thanks to you, doctor. Thanks that I found you. Yeah, and the herbals works perfectly, absolutely. And the most important, it's natural.
Natural. Yes.
Yeah, for me it's important. Yeah, natural, like more natural food. If you need some medicines, then more natural. Yeah, to didn't harm, your kid's body. Yeah.
Yes. Oh, it has been so much fun working with you. and Carolina. It's been fun. It's been a privilege. I mean, she is beautiful and smart and more girl power to her is what I would say. Yeah,
Yeah.
she's gonna make you proud one day.
Oh, she will. She will. She
Yeah.
already made, every day there's something new, something new coming. And I said, yes. And my husband, he saw finally she started talking and, yes. It's maybe it's a bit harder for him because, like, he didn't, research everything about that. He don't know exactly what is that, but he see that there is something happened with her. Why she didn't talk and strange behavior, and now he told finally, finally, yeah.
So I guess Papa is happy.
Papa is happy, very happy, yeah.
That is important. We have to keep the papas happy.
Oh, yeah, yeah. Exactly,
Good,
yeah.
good, good. That's good to know. I'm obviously I was just kidding, but that's good to know. Good to know. All right. See, good. So I'm so glad you were able to do this today. It's going to help so many other mothers and fathers watching, and that knowing that in an all natural way recovery is possible.
Oh,
So
it is possible. I think that everything is possible. If you see something wrong from outside with anyone that you can recover. Yeah, yeah, it's very important. Like, there's a lot of parents who don't believe that they can, improve their kids' health. Just don't believe. They think, oh, it's autism. That's forever, and that's it. But no, it's not like that. That's
I would
mean that
agree.
something caused that autism. So there's something wrong in that body. Yeah.
Yes, and I'm glad that we did so many labs, right? Were you shocked at the lab results?
Yeah, yeah, I didn't expect, the results that she has a Lyme disease and, and everything else and inflammations, and I was shocked, yeah. Yeah. Such a
Yes.
small body, but yeah, it is what it is, yeah.
Yes. Well, at least the diagnosis of autism, will not be applicable anymore, right? Lyme
Yeah,
disease, pandas, you can manage.
yeah, yeah,
That
yeah.
is one good thing. Yes. Wonderful. Well, once again, thank you for joining me for today's
Oh, no problem.
podcast.
I'm happy to share my story.
Okay, to everyone watching, I hope that was helpful and inspirational. And I will see everyone here back at the next episode of the BioNexus Health Podcast. Until then, namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.